Hi, doctors. Welcome back to the new episode of our A to Z series, wherein each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET, PG, and FMGE. And our today's episode is episode G, where G stands for GERD. So let's begin our today's discussion and learn more about gastroesophageal reflux disease. So, what is GERD? It is a digestive disease in which stomach acid or bile irritates the food pipe lining. This is a chronic disease that occurs when stomach acid or bile flows into the food pipe and irritates the lining. Acid reflux and heartburn more than twice a week may indicate GERD. So now let's talk about the symptoms associated with GERD. First, we have a burning sensation in the chest. Next, chest pain, regurgitation of food or sore liquid, difficulty swallowing, sensation of a lump in throat. Chronic cough, laryngitis, new or worsening asthma and disrupted sleep. Now let's move ahead and talk about the risk factors associated. Obesity, hiatal hernia, pregnancy, connective tissue disorders and delayed stomach emptying. Do you know what aggravates acid reflux factors? Yes. Drinking alcohol, smoking, taking aspirin, eating fried foods and eating late at night are the aggravating factors. Now let's solve a few MCQs and learn more about GERD. Which of the following is the best investigation to establish a diagnosis of GERD? Option A, 24 hours ambulatory pH monitoring. Option B, upper GI endoscopy. Option C, CECT. Or option D, MRI. So which option according to you is the correct one? Well, yes, option A, 24 hours ambulatory pH monitoring is the correct answer. So now let's move ahead and talk about the key features of GERD, gastroesophageal reflux disease. It is caused by an incomplete LES, which means lower esophageal sphincter, progresses through reflux of gastric content leading to esophageal ulceration, fibrosis, stricture formation and potentially Barrett's esophagus and adenocarcinoma. Now let's talk about the clinical features. The clinical features of GERD include retrosternal heartburn, epigastric pain, and regurgitation. Diagnosis involves 24-hour ambulatory pH monitoring with a Demister score which is above 14.7 that indicates GERD. Now let's talk about management. The management of GERD includes lifestyle changes like quitting smoking and reducing caffeine intake, along with avoiding large meals before lying down, double dose PPIs, and laparoscopic niacin fundoplication. Now let's move ahead and discuss the second and the last MCQ for today. A patient who underwent niacin fundoplication was seen in the ward during evening rounds. He is asymptomatic at present with stable vitals. What is the next line of management for this patient? Option A, nasogastric tube to prevent gas bloat syndrome. Option B, insert chest tube to prevent pneumothorax. Option C, monitor vitals. Or option D, imaging to rule out perforation. So which option is correct according to you? Well, yes, option C, monitor vitals is the correct option. So let's end our today's discussion with discussing the different types of fundoplication. Primary fundoplication procedure includes Nisen's fundoplication. Whereas the lesser common fundoplication procedures include Watson fundoplication and Belsey Mark IV fundoplication. And last, the most predominant partial fundoplication procedures include DOR fundoplication or Toupet's fundoplication. So that's all for today's episode. Thanks for watching and see you in my next episode, which is going to be episode H. And yes, please don't forget to subscribe my channel.